Hi. I would like to take the next half hour or so to provide an audio um, narration of the history of community public health. I tried a number of different strategies to try to um, make this available to those of you who are using um, Windows on your personal computer. And unfortunately, when I redid this presentation on the history of community public health, I used my new Mac, which isn't compatible for those of you that are using Windows. So if you're interested in looking at this presentation, if you would just follow along with your PowerPoints, then I will just narrate them and try to give you the information that way. So the one very interesting thing, and if you look at that introductory picture, you see a variety of different community public health nurses along our history. And my intent with this was just to give you a flavor of how important community health has been in improving the health and lives of the citizens in the community during each of the time periods. So if you look at the first PowerPoint, historical perspective, um, history, again, can be used to increase understanding of public and community health, nursing from the past, and hopefully we can use some of their solutions or their ideas to um, challenge um, what we see occurring now and then in the future. You know, you have to think about all cultures have been concerned with events in their lives surrounding birth, death, and certainly significant illness. And whatever the community was at the time, they have tried to prevent, understand, and control disease. And it had certainly a lot to do with their current knowledge of science, the technologies they've had, and how organized their society was. If you move then to the next PowerPoint, this is just a representation of even back in, think about our historical past, even back in with the ancient Babylonians, they understood the need for hygiene and medical skills. And Egyptians in 1000 BC developed pharmaceuticals. They also knew it was important to construct early privies and drainage systems. Um, on the next PowerPoint, it is a statement, and these are the main objectives of the 1601 Elizabethan Poor Law. And I just thought this was interesting to include because, as you can see, it addresses providing assistance for the poor, the blind, the lame, and also set up these places to live called almshouses, or they were poorhouses. And I thought it was interesting with this too that it certainly pointed to able-bodied poor that they should work in a house of industry. If they were not willing to do this, and certainly became what would be called vagrants, they were sent to prisons or the House of Corrections, and it even stipulated on um, the importance of poor children, pauper children, learning a skill or becoming an apprentice. So these kinds of um, these kinds of objectives to make a healthy, productive workforce have been around for a long time. The next is a lovely picture, very artistic. I always have to think about my directions here. Very artistic representation of the Industrial Revolution in 19th century Europe. And this did bring a lot of technology, transportation, and communication among citizens. But one of the difficulties is that as they moved from rural areas into these urban settings, they lost the support of their families. So when they were sick, yeah, it could be very difficult for them. The next picture, again, very artistically done, is looking at the religious women, typically Catholics and Protestants, who would go out and try to help um, the sick and the ill in their homes. They were not educated, but they were caring in their endeavors. Um, on page 5, again, a very lovely picture. Here we go with our directions of Florence Nightingale, and she is known as the mother of nursing education and training. She cared for soldiers during the Crimean War, 1853 to 56, and she is very interesting because she used population-based nursing, and that's what we're all about in community public health. She improved the environment by doing simple things like opening the windows for fresh air, bathing the soldiers, making sure they had a good nutrition, and looked at sanitation and hygiene. And she actually, if you then follow through with the next PowerPoint, this is what's called a coxcomb, and if you follow it around, what she was really able to do is drop the mortality rate among the soldiers during this time period tremendously by these very simple techniques. So she dropped what they say the mortality rate dropped from 415 per thousand soldiers to 11.5 by the end of the war. So she really was um, really instrumental in making this um, population healthier, even though they were fighting a war. She was then went on to create district nursing in London with a gentleman called William Rathbone, and we'll see her influence again in the United States. The next photo is of the first hospital in the U.S. This is the Philadelphia Hospital, and just to think about this building is still standing. It was opened in 1751, and it was actually opened by Benjamin Franklin. He was one of the benefactors. And during this time, this is the same, we saw the same trend in the United States as we had seen in England with the individuals moving from rural areas into the cities and really this industrial revolution that occurred. Same kind of problems, lack of family members to help care for people when they were ill. The next photo is the seacoast, eastern seacoast, in particularly focusing on um, the ships that were coming in and could possibly bring in disease. Um, it was another kind of interesting fact was that the rich often um, stayed at home to be treated, and physicians visited. Poor went to the hospitals, and um, the wealthy people in these um, colony seaports were very concerned about what kind of diseases were being brought in. And this is when we started to see a collection of vital statistics, improvement or work on improvement of sanitation systems, and again, trying to control communicable disease so they could decrease the likelihood of epidemics. It didn't work real well, but that was on everyone's mind. The next photo is looking at what this is called is unhealthy New York, and you can just see the mud, dirt roads, horses, again, that were creating transportation, but again, think of the contamination that they contributed to on the streets. Um, this is after the American Revolution. We saw a big threat of yellow fever, and we started to see the beginnings of what are called the boards of health. They were looking at monitoring water quality, constructing sewers and waterfront walls to protect the coast, draining marshes to get rid of mosquitoes and other vectors, planting trees and vegetation to save the soil, and then burying the dead so that there wasn't contamination that would be continuing. Again, the next photo is a very nice representation of our industrial revolution, very beautifully done, but not quite as idyllic in reality. So the big thing I want you to understand is this was the invention of the steam engine. And again, if you look at the next photo, this is the face of a young coal miner. And this is the reality of it. There were young, very young men that were working in this industry, and it was a dirty, dangerous job. Other problems that they ran into, because this was a huge industry, because of the Industrial Revolution, they didn't have enough housing, sanitation was a problem. Again, epidemics were running rampant. We still had TB and malaria in many areas, and the infant mortality rate was about 200 to every 1,000 live births, so not a good um, statistic. Next picture is what a current hospital would look like in that time, and they were pretty bleak. They were unsanitary, the workers were not trained appropriately, and physicians even had limited training. And the money that was going into healthcare was really on this focus on merchant seamen and protecting the ports. Um, Following photo of, again, another building that is important. This is the um, first, or really, I'm sorry, the Marine Hospital service that opened in 1800, and it was really where public health services got its start. So something that's very important. The next statement is from the Ladies Benevolent Society, and I included this because this was very common during this time. The kinds of care of the sick, or the people that um, were offering care to the sick in the communities, were organizations like this Ladies Benevolent Society of Charleston. Um, they actually were laid the foundation for the lay nurses in Philadelphia, which really became what we know as the visiting nurses. But they even struggled, who to provide care for how long, uh, if there were costs involved, who would pick up the tab. The next photo, if you're again following along, is of a Philadelphia almshouse, and these are these poorhouses. Um, During this time, this is during the mid 1800s, we had increased interest in public health and improving living circumstances of citizens. These beginning boards of health began addressing communicable disease and environmental hazards. And in 1847, the American Medical Association formed what was called a hygiene committee to conduct sanitary surveys and develop systems to collect vital statistics so they could keep an eye on what was going on. The almshouses, again, were a place for the poor and the destitute. At least they had a place to go, which is certainly more than sometimes we see now with our homeless population. The Shattuck report on the next PowerPoint, this is William Shattuck, and he was very influential and farsighted, and he published these recommendations to improve health, and it was a model um, for the future of public health in communities. It took a long time to get there, but at least this was the beginnings of getting this idea out to look at constructing a sanitary approach to to decreasing disease. So if you just look, he recommended, first of all, that every state have a health department and then local boards in every town, the conduction of sanitary surveys, and again, the collection of vital statistics, environmental sanitation, food, drug, and communicable disease control, well child care, health education, dealing with then problems with alcohol and tobacco, town planning, addition of preventive medicine and medical school training. And again, it all took a long time. The next photo is a picture of the first nursing school that was opened in the United States in 1870, and it was based on the Nightingale model of rest, nutrition, sanitation, and hygiene, and fresh air. It's just so interesting that these are such simple concepts, yet had such a remarkable impact on the health and well-being of citizens or those that were ill. Um, it was kind of interesting too. Private duty nurses during that time worked for the well-to-do, so they could pay for their services. And Wasn't until 1877 in New York City that the city, again with these beginning boards of health, hired Frances Root, and she was the first visiting nurse, and established this idea that she could take care of more than one patient per day, and that education and well baby visits were paramount. The next photo is of public health service officers at Montauk Point in New York. It was a quarantine station. And again, this is that same idea. As immigrants from Europe arrived in the United States, wealthy citizens became concerned about diseases that they were bringing from their homelands, like England, London in particular, Ireland, Italy. And the wealthy people went so far as to fund what are called settlement houses in urban areas, and we'll see what impact that had. And they also really pushed to establish visiting nurses. Um, I love the next photo as well. Let's see if we can get this up here now. Um, these are two very well-known nursing professionals early in our history, and the one on the left side is Lillian Wald. She, along with another nurse called or named Mary Brewster, established the Henry Street settlement, and this was one of these tenements. This happened in 1893. And what the Henry Street settlement did is that these two nurses actually lived in the apartment building with their families that they cared for, and they were hubs to healthcare and social improvement programs. These nurses worked with the families. They helped, again, improve their nutrition, their general well-being. It had a lot to do with maternal child care, and then even worked on voter rights and also working with landlords to improve the conditions of the buildings. The picture on the right is Lavinia Dock. She was also involved in this movement, and she was very outspoken. She worked with the suffragettes, again, to get the vote for women. She was very, again, knowledgeable about um, treatment for um, venereal disease, which were our STIs, and also other taboo subjects that people didn't want to talk about in public. Another great photo, and I want you to take a look at this. I remember this from my own community nursing days. This is a public health nurse saving steps and crossing the rooftops of these tenement buildings so that she could increase the number of people that she saw during her visits. And again, the focus was always improved sanitation, um, trying to help them with economic matters as much as they could, and then better nutrition. Clara Barton is again pictured in the next PowerPoint. She was the founder of the Red Cross, and I love it. She was 60 years old when she did this. Prior to that, she helped care for soldiers during the Civil War from 1861 to 1865. In addition, as the American Red Cross was developed, they also instituted what was called the Rural Nursing Services, and this was the first time that nursing care moved out of the large urban areas and into the rural villages and farms. Again, same thing, care of the sick, instructions in sanitation and hygiene, and improving living conditions. Our next photo, as you're following along, is just, again, a nurse caring for black soldiers in New Orleans. And one of the things I want to point out, this is a VNA nurse, and this is where we started to see the split between the philosophy of VNA and also public health, because up until then they were kind of back and forth, and it was either a visiting nurse or a public health nurse, and there wasn't much distinction. The VNA at this point started to look at their agency values, and again, they decided not to become a governmental agency. They depended on philanthropic funds from people that were well-to-do that would help support their organization. And again, they tried to always determine clinical priorities and important service areas where they would go out and care for individuals. Um, but that was a huge differentiation, whereas, again, public health nursing is always a governmental agency, whether it's a city or a county. The next PowerPoint does look at, again, talking about really the formation of the American Public Health Association. And it was established in 1872. And again, look at the target areas. I always have to smile because when I start a community or public health course, I usually start talking about sewage and garbage disposal, and students are often a little bit surprised. But these are huge areas for health. If we can't control sewage in our communities, if we don't have a place to dispose of garbage safely, we're going to have more disease. Occupational injuries was also a huge thing. And again, think about where these people were working, many of them in the mines and other industries that were not regulated by OSHA. And then sexually transmitted diseases, again, were fairly rampant. And we'll talk in a little bit about what did help improve and control STIs. Um, Again, these areas continue today as focus areas along with many of the other ones that we've talked about already or you've seen discussed in this course. The next couple of pictures, too, just take a look at them. These are from uh, a museum record or resources. And these two pictures are of tenements in New York. And again, we're still seeing, this is in the late 1800s and into the early 1900s, formations of local health departments. And again, the big um, push was on environmental hazards, crowded living conditions, dirty streets. They were trying to regulate things like public bathhouses, slaughterhouses, and pigsties. And by 1900, 38 states had established a state health department. They spent 2 cents per person on healthcare needs. Just interesting to think about how costs have changed. And also, um, lots of redefinition from the government on what the U.S. public health services should look like. And then that second picture, just look at all the trash. I don't know if that's the front of the building or if that's in the back by an alleyway. The next PowerPoint discusses the Marine Hospital Service and public health and how it became public health services and what they were charged with. Investigating causes and spread of disease and pollution and sanitation of navigable streams and lakes, and then targeting infectious and parasitic diseases in rural areas like hookworm, typhoid fever, and malaria. If you look at this picture, malaria control was one of the main methods was to use drip cans with oil and kerosene, and it would kill the mosquitoes. Um, the next photo, again a great one, is of a public health nurse in 1922 in her Model T Ford. And she went out and immunized against typhoid. She made weekly well baby visits and had conferences to include a number of families and get her message out. This approach was so successful that we saw the Rockefeller Foundation, along with the California Health Department, increase dollars for public health professionals. And we also saw the establishment of what's called the National Organization for Public Health Nurses, and this was um, an organization to try to really promote public understanding of what public health was trying to do. The next photo, again, just a gem of a group of public health nurses in their navy blue uniforms. They look very serious, but it's interesting. When I worked at the health department in the 90s when I was being oriented, my boss made a mention of, well, you don't have to wear navy blue, but you're probably going to see a lot of it. And then when I saw this photo, I understood it. They were very much into these uniforms as a way to identify who and they were and what they were doing. Again, another artistic representation. This is Jane Delano, and she was appointed superintendent of the Army Nurse Corps, and she was also the chairman of the Committee on Red Cross Nursing Services. And this is during World War I, 1914 to 1918, and we needed nurses both abroad and in the United States. In the next photo is just, this is from 1918 and the worldwide flu epidemic. or pandemic, I should say. And this is just a field that was converted into a hospital. Um, the National Organization of Public Health Nurses and the Red Cross turned fields, social halls, churches, houses into hospitals to treat people and try to save their lives. The next document is the Shepard-Towner Act, and it was aimed at decreasing mortality in the 20s. And it was repealed, but it really established or laid the foundation for maternal child health divisions in the state health departments, and this is something we still see today. A nice rural photo. Our great nurse Lillian Wald, along with other individuals, um, collaborated with the Metropolitan Life Insurance Company to launch a program for visiting nurses to provide care for sick policyholders. They were so successful that by 1918, they had a 7% decline in mortality of policyholders and a 20% decline in mortality of policyholders' children. Um, these kinds of programs continued until we started to really into the 50s, until patients started living longer and also medical care increased. Another rural photo. This is of uh, the area that was serviced by what's called Frontier Nursing Services, and Mary Breckenridge was the nurse that established this. This was in 1925. This was in Hayden, Kentucky, and they had outposts all along this area in Appalachia. Another great photo I love. This is Mary Breckenridge on her horse. And again, these nurses went out and visited um, people. They estimate 10,000 individuals spread over 700 miles, and they provided nursing and midwifery services 24 hours a day, 7 days a week. The clinics also were centers for medical, surgical, and dental care. So just a great asset for rural areas. Next photo is just a physician out in one of these rural homes. And then what I want to, again, just emphasize is the splinter that we saw between the VNA and public health nursing. So the Federal Emergency Relief Act really made this more consolidated. We saw the VNA, they were supported with money um, and grants for state programs. They also helped them purchase medical um, uh, equipment and again made more resources available so the VNA could continue their mission. This was around the time of the Depression, and again, we saw decreased funding. Nurses in some areas lost their positions. So while this Federal Emergency Relief Act really helped the VNA continue nursing services for individuals and individuals and family members. This is where we saw the splinter occur, and public health really have this focus of working with groups and populations in the community. I always want to stress public health nurses work with individuals, but their main focus is really to provide care, again, that's based on the needs of the community that they service, so the population groups. Um, this Relief Act also provided dollars for um, additional public health nurses across the United States. So it was very important and really was um, an important act that provided money for nursing both in private organizations like the VNA as they became, and then public health governmental agencies. Um, the next photo is just nurses providing services in rural areas. The one after that for blacks in the South. And then we get to 1935 and the Social Security Act. And um, these are important because a lot of these priority groups and diseases remain today. And if you look to the right first, These are the kind of programs that we still see public health really support. Maternal child care, crippled children, venereal disease treatment for STIs, tuberculosis, certainly making sure that we keep the community healthy, mental health services, industrial hygiene, and dental health. And again, if you look then at the left, the Social Security Act of 1935 really focused on problems with depression. Um, we saw more funding for health protection and even then promotion. Dollars again for additional public health nurses, and again, this importance of maintaining state public health services. Next photo is a public health nurse with migrant workers in the 40s. Next is a during World War II, we had an increased need for nurses abroad and at home. And in 1943, the Bolton Act established or created what was called the Cadet Nurses Corps. It also looked at providing more funding from the government for undergrad and graduate degrees of nurses. This is a great photo as well. This is on a mailbox, and it's when penicillin um, hit the public. Cures gonorrhea in 4 hours. Isn't that great? And we did see a lot of need for increased services. This was after World War II. The soldiers were returning not only with communicable diseases and STIs, but emotional problems. They suffer from accidents, and there was a high rate of alcoholism. So lots of important things being done. Just a few more, and again, this is just to give you an idea of kind of how things have moved along in history. World War II to the 70s, public health services, childhood mortality rates decreased with expanded life expectancy on the other end. Cause of death moves from pneumonia, TB, diarrhea, and enteritis to heart disease, cancer, and cardiovascular disease. And again, services at public health, sometimes we saw changes in the venue, immune camps. There was a lot of focus on nutrition, education, better hygiene and sanitation, better housing, and even um, their input on improved critical care services. This is when we saw also the movement of patients into the hospitals and the decrease of home visits. Physicians didn't want to make house calls anymore. They decided it was just easier to see a group of patients in one facility. So that again changed the landscape of what was going on in the community, especially with visiting nurses. Um, it wasn't until the 30s and 40s that health insurance programs covered hospital care. So that was an important change as well. And so places, or I should say agencies like the Metropolitan Life Insurance Company and the John Hancock Life Insurance Company ended their support of visiting nurses. So they had to start to look for funding, again, more from individuals and, again, people that were wealthy. Grants, again, in the community, those kinds of things. Another addition, and I think you'll appreciate this since you're moving in and finishing up your BSN in nursing, Bachelor of Science in Nursing. This is when the National League for Nursing Ed, the National Organization for Public Health Nurses, and what we call the Associate of Collegiate School of Nursing formed the NLN, the National League of Nursing, which is now called ASIN. And that was in 1952. And they really did promote, again, nurses getting their education in university and college settings. One of the things, and I know I would assume many of you went to ADN programs, it was also during this time that we had a huge nursing shortage. So nursing education also opened up at the junior community um, school or college level to provide that first entry as an ADN, and then also, um, again, with the emphasis that the importance of moving on and getting your BSN. Um, World War II to the 70s also for the VNA. This is where we saw an adoption of coordinated home care programs, really dealing with complex long-term care to chronically ill individuals. And again, with this idea of multidisciplinary approach, which is so important when we have individuals in the home with a lot of needs. Um, Again, as I mentioned, I don't want to make and keep repeating this, but funding was an issue. Some insurance companies were reluctant to pay for home care. I think that still is something that can be an issue for individuals that want to stay in their home. And the one thing that did help in 1965, we had the passage of the Medicare legislation, so that did help with funding for people that were that was available for. And then just to finish up the trends in the 70s, hospice, birthing centers, daycare for elderly and disabled, drug abuse treatment centers, rehab for long-term care, and increased costs of health care, as we all know. One of the things that I just want to emphasize, during the Reagan administration, he made the change or changed funding sources to public health. And whereas before certain dollars were allocated to state health departments and then with funneling to locals in the city or counties, and it was just kind of a given amount of money, the Reagan administration developed what are called these block grants. So, what it required the health departments to do then is to um, apply at each cycle for funding for this money. And whereas it certainly is what we see everywhere, they needed to keep um, solid statistics. They needed to prove that the way they were utilizing the money was being effective. Um, it also allowed other agencies to move in and apply for these grants as time went on. So sometimes the dollars that were usually available for services at the city or county levels all of a sudden weren't available, and they had to look at other funding sources or drop programming. So just to kind of keep that idea in mind, that it isn't just a given amount of dollars that goes to public health. They have to work for the dollars that they are putting into the communities that we live in. And then just to emphasize, as you all know, and we've already started to talk about that in this course, is the initiation of the Healthy People Initiative. And this started in 1979, and it has moved through. We had Healthy People 2000, which had a, a lot of agenda items in each area of healthcare. And this is a 10-year cycle that we see with Healthy People. So every 10 years, we have a new document that comes out, and then obviously these groups that are working on these initiatives see what has been accomplished, what has been successful, maybe has decided that some areas that they were trying to work on were not um, um, they weren't economically feasible, or it wasn't something that was going to change, and they move on to new kinds of criteria and agenda items. So the overall goal, again, is this is a national strategy to improve the health of Americans by preventing or delaying the onset of major chronic illnesses, injuries, infectious diseases. And again, along with it, what we've seen occur in these last couple of years is the implementation of the Affordable Care Act. So again, allowing people that had no insurance or limited insurance to get the coverage they need. So I'm going to end this here. I hope this helps. I'm sorry about the issue with the Mac, but at least I'm wanted to provide my insight into this PowerPoint if you can just view the pictures. So I will be in touch.